Greeting from Bumrungrad Hospital Talks. I am your host, Dr. Laura, Doctor of Pharmacy, and in today's episode, we are going to talk about spinal surgeries. There are many myths and simply misunderstanding about spinal surgeries, so some people are afraid of this type of treatment. And today we will try to debunk those myths with one of the leading spinal surgeons in the region. I'm delighted to introduce my guest, Dr. Verapan, a neuro and spinal surgeon and a director of Bumrungrad Spinal Institute. Thank you, Dr. Verapan, for joining us today.
Thank you for inviting me.
And may I ask you to tell our audience about yourself a little bit, your specialties and your experience?
Well, I'm a neurosurgeon by training, specialized in the spine surgery, especially the minimally invasive surgery, and the leading procedure that we have been doing for the past 15 years is the endoscopic spine surgery, which is the least invasive surgery. I'm focusing on that.
Oh, that's great, doctor. And I know that you actually conduct some trainings in spinal surgeries as well.
I work with Professor Sebastian Ruten, who developed this technique, and this instrument is a German professor for the past 13 years. And we have been organizing the workshop together, both in Germany, in Thailand, and many countries around the world. We have been training over 2,000 spine surgeons across the world, from United States, in Europe, or in Asia Pacific.
Oh, that's amazing, doctor. So, and one of our biggest questions, are all spine surgeries major or complex surgeries?
Major and complex.
Yeah. Are all of them major or complex?
If you talk about surgery, we do under general anesthesia, so we call it major surgery. But some patients think that major surgery is a big surgery. It is not, but it's major and complex, because in order to cut big to operate, we make just only one hole, less than 1 centimeter. So that's demanding in terms of equipment, training, and also the technique. And we do under general anesthesia. Yes, so my answer is yes, it's major, it's complex. But another half of my job is intervention. Intervention means we do injection, we do laser, radio frequency to the spine to reduce the pain under local anesthesia, but we do it in the operating theater. That is considered as minor.
Oh, thank you, doctor, for clear that up. And now the next question, will spine specialists always recommend surgery? And are there any other treatment options?
Other options from surgery?
Yes.
Of course, we diagnose the patient, take history, physical exam, and with the serious case, we do X-ray, MRI, nerve test, and then we make precise diagnosis. This is step one. And for the treatment, we start from the conservative treatment.
So not surgeries? No.
Surgery is the last on the list always. Okay, no one wants surgery. But we have the strict indication to do surgery for every patient, and we have the committee and meeting, look after every case that will proceed to surgery. That's important. But the first step always conservative, like physical therapy, pain medication. And the second step is intervention, like cortisone injection to the spine, radio frequency for the pain. But certain indication for surgery, such as weakness, okay, when you have nerve pinching, the nerve control the muscle. So when you have a lot of weakness, that means your nerve is under compression, we need surgery. And if the first two steps fail to improve the pain within 3 months, that's an indication for surgery.
Oh, that's great to know, because a lot of people, they're under impression that if you go to see spinal surgeon, they will recommend you a spinal surgery straight away. Thank you, doctor, for that. All right, the next question. You actually already talk about that a little bit. Maybe you can add something else to that. So what diagnostics are essential for spine specialists to provide treatment plan?
Yeah, as I mentioned before, the most common that we do is the standing and bending X-ray.
Okay.
So many patients ask, why do we have to do both MRI and X-ray? We see more with the MRI. Yes, we do MRI, but the reason that we have to do X-ray, because MRI you lie down in the machine, no load to the spine. But with standing and bending, we put load on the spine and we see the stability of each vertebra, which we cannot see 100% from MRI because you lie down. So basic is X-ray and MRI. And in some patients that the diagnosis is still not clear, we do the nerve test to differentiate other nerve disease from the nerve pinching from the spine. Yeah, and other than that, I would say this is the main investigation for diagnosis.
Oh, that's amazing, interesting. Actually, a lot of patients quite wondering why they have to do the X-ray as well. Right, so the next question, do spine surgeries take a very long time?
You mean after the surgery?
No, the surgery itself. So how many hours is that?
Or the surgery itself, it depends. The most common that we are doing is the endoscopic surgery for the slip disc. 2 hours in the operating theater, but the real surgery is around 1 hour. Okay, because we have to put the patient to sleep, flip the patient, and then after finish the surgery, we flip back, wake up the patient. That take 2 hours, door to door. But skin to skin, the cut until you make a last stitch is 1 hour around. For the difficult case, like stenosis, one level, we may need additional half an hour. Or if you have more than one joint, the problem like 2 joints, each joint we need 1 more hour. So it can be up to 4 hours for the endoscopic, but not more normally. But if we have to perform fusion, in some cases that stability is also the problem, we need to fix with the screw. For one level, we need around 3.5 hours.
Yeah, but this is complex already, right?
Yeah, more procedure done and not with the endoscope.
Mm-hmm. But endoscopy just takes very short time. It's amazing. It's only a couple of hours.
But the amazing part for the patient is when they wake up.
Yes.
They feel very minimal pain at the wound and the pain before surgery gone, and then they walk immediately and they want to go home.
Oh, that's a miracle actually, yeah. All right, so the next question, are complications after spine surgery more severe in comparison to surgery on other organs?
Well, if you compare to other bone, like arm, hip, and knee, so the spine is different because the spine, you have a lot of nerve in the bone. But for your arm, you have the nerve around the bone. Okay, so if complication happens for the spine surgery, it will be more severe than other skeleton surgery. But when you compare to the brain, of course, the brain it's more severe than the spine. But if we talk about the complication, the most common that the patient asks is cannot walk after surgery or lose the power permanently, which in our hands the percent is very low. That's a permanent damage that maybe foot drop. It is less than 1%. Actually, it's 0 point something. We don't count percent because it's happened in very bad and difficult case from 1 or 2 cases in 5,000 cases, that kind of thing.
Wow. And
if you talk about the neck surgery, the spine and the neck, there's a spinal cord. Of course, if something happens, you can be paralyzed. That's a point that the patient is afraid to go for surgery, and that's true. But every time we inform the patient about success rate and also the complication, and with the percentage in our hand as well. So when the patient see that we have very low percent of complication. So they're happy. So there are some questions to be asked all the time. If the patient don't ask, I have to inform them. Success rate, complication in our hands, other option than surgery, always option. If the patient doesn't want to go for surgery, any other option like intervention or even the first step like conservative. Most of the case for the pain, there are options. But if we talk about disability, weakness, cannot walk, normally there's no option.
Right, so that's very important as well to do it in well-established clinic. It's very important to know that your surgeon is experienced enough with the procedure as well.
Yes, and another point is many patients ask me why Bumrungrad don't open the specialty hospital, like a spine hospital. We say, well, at Bumrungrad Spine Institute, we call ourselves institute because we do research, publication, we teach. It's like a medical school already. It's like a specialty hospital already. But we cannot stand alone because the patient that we operate, 60, 70, 80, even 90 years old. So if you stand alone in the hospital, it's only the anesthesiologist and the surgeon. No heart doctor, no kidney doctor.
Oh, yeah.
Okay, so that's you can do only easy case at young patient in the specialty hospital, not the complex and difficult case. That's the reason. So we call ourselves the small hospital in the big hospital already.
Yeah, I know. They will have a great team of doctors here. And this is very important especially for complex cases, especially for people who are elderly as well. All right, and the next question. Is full recovery from spine surgery nearly impossible and takes forever?
No, that's not true. There's a certain time. For endoscopic surgery, it's quick because you cut less, 1 centimeter or less. And the healing process is 6 weeks. Okay, so the patient, normally they don't feel it because the pain is minimal. I give only Tylenol. Okay, but for the fusion,
only Tylenol, really?
Yeah, because
wow.
The minimal pain, most of the case.
Yeah, okay.
Not every, of course. But for the fusion, the bone start to fuse at 3 months. So the recovery for the fusion will be longer.
But this will be fully recovered, right?
Yeah, but if you talk about walk after surgery, for the fusion, we do with the minimally invasive technique and the navigating system. So the patient walk next day. But for the endoscopic, walk immediately once they wake up.
Oh, that's amazing, actually.
And it's good for the international patient that they want length of stay, quite precise. So normally we say, if you inform us before you come, that you're going to come for surgery, before and after, maybe they can go back within 7 or 10 days.
Wow, it's so quick.
Yeah.
All right. And the next question is, and the last question, I hope, will a patient get addicted to painkillers after surgery?
Normally, if they have to depend on painkiller, that will be before the surgery. And this kind of patient, we cannot just cut the painkiller immediately after surgery because the pain threshold of this group of patients will be low. And chronic pain, we're talking about pain that for years, like that. So that's why we say that if every treatment fails to improve the patient, surgery should be decided in 3 months. If we live too long without surgery, number one is nerve damage will be more and more, and pain will turn to be chronic pain, which is more difficult to treat even after surgery. Okay, so that's a point. But you asked about drug addiction after surgery. That's not the point because we do minimally invasive. We don't use a lot of painkiller.
All right, yeah. I see. Okay, so that's actually kind of myth. All right. Oh, that's great. Thank you very much, Dr. Verapan, for debunking those myths about spinal surgery. And I hope This episode will help some people to overcome their anxiety about visiting spine specialists. Thank you everyone for your attention. To learn more about spinal surgeries, please visit Bumrungrad Spine Institute's page at bumrungrad.com. This is Dr. Laura and Dr. Verapan from Bumrungrad Hospital Talks. Please subscribe to our podcast for more episodes. Stay safe and healthy.
All right. Thank you.
Thank you very much, Doctor.